You're going to speak first, aren't you? We'll see.
Okay. Good afternoon and welcome to our daily briefing on COVID-19 status in the country. Ladies and gentlemen, in the last few weeks we have been highlighting other diseases that compound the problem of COVID-19 that we are currently grappling with. We have observed that the disease can be severe in people with other underlying conditions. Some of these comorbidities, such as diabetes, cancer, TB, hypertension, HIV, have been part of the overall health promotion strategy of the ministry. Today, we are marking a milestone in the fight against TB in Kenya as we launch two important policy documents to guide our efforts in ending TB in the country. TB remains a global and national public health concern. Globally, 104 million people are infected with TB, of which nearly 1.5 million die each year. In Kenya, TB is the fifth leading cause of death. In 2019, we reported and treated 86,504 cases of TB, of which approximately 10% are children. Drug-resistant TB cases have been on the rise, with 688 such cases in the country as of 2019. Despite TB diagnosis and treatment being offered free of charge in public and faith-based facilities, not all that are infected with TB are reached and therefore do not receive the required care. This is a challenge for our TB program, and we are continuously working towards reaching all those that are infected with TB so that they can get the right care and the proper care. One of the policy documents that we are launching today speaks to the rollout of a regimen for treatment of multiple drug resistance TB that is devoid of injections, in line with the World Health Organization's call to eliminate injectables from multiple drug resistant TB treatment regimen to improve treatment outcomes. The second policy document addresses preventive treatment of latent TB infection offered to individuals who are at risk of developing active TB. Preventive treatment has proven to be an effective intervention to curtail development of active TB disease. These two policy documents on TB are key to the ministry's strategic goal of ridding the country of TB by 2030 as envisaged in Vision 2030 and the Sustainable Development Goals. At the end of this brief, we shall hear a little more about TB and from some of our guests who are here with us at the podium today. I will introduce them at that time. But let me now move on to the statistics of the day, which with COVID-19, the situation in the country over the last 24 hours. Ladies and gentlemen, today we have tested 2,419 samples over the past 24 hours, and among these samples, 176 have tested positive for the disease. This now brings to 6,366 the total caseload in the country out of 169,836 samples that we have tested so far. All the 176 Kenyans are Kenyans, and 100 of them are males, 76 are females. The youngest is a 3-year-old child, and the oldest is 78 years old. The cases are distributed in the counties as follows: Nairobi with 99, Mombasa with 20 cases, Kiambu 17, Migori 13, Uasin Gishu 10, Kajiado 4, Busia 4, Kilifi 3, Makueni 2, Machakos, Narok, Kisumu, and Kakamega 1 case each. We go down beyond the counties at the sub-county level. In Nairobi, the 99 cases are in the following sub-counties: Dagoretti North 24, Starehe 16, Westlands 15, Embakasi 13, Kibra 7, Makadara 5, Kasarani 4, Langata 3, Embakasi Central 2, Dagoretti North, Embakasi South, Mathare, and Roysambu 1 case each. In Mombasa, the cases are in Mvita 7, Kisauni 5, Changamwe 5, Jomvu 2, and Likoni 1 case. In Kiambu, the 17 cases are in Kiamba 7, Kikuyu 5, Ruiru 3, Juja and Thika 1 case each. In Migori, the 13 cases are in Kuria West 11 and Suna East 12. In Uasin Gishu, the cases are in Anabkoi 7 and Tarbo 3. In Kajiado, the cases are in Kajiado East 2 and Kajiado North 2. In Busia, the cases are in Matayos 2 and Teso North 2. While in Kilifi, the cases are in Kilifi North 2 and Magarani 1. In Makueni, the 2 cases reported there are in Kibwezi West, while in Machakos, the 1 case is in Athi River. In Narok, the 1 case is in Narok West. In Kisumu, the 1 case is in Kisumu Central. And in Kakamega, the 1 case is in Malava. Today we are equally delighted to inform you that 26 patients have been discharged from various hospitals, bringing to 2,039 the total number of recoveries. Once again, our appreciation goes to our dedicated healthcare workers for this achievement. Also, on a sad note, we want to inform you that we have lost 4 more patients to the disease, bringing our total fatalities due to COVID-19 to 148. We send our heartfelt condolences to the family and friends of the departed. I would want at this point to switch gears again and invite our guests who are here with us, who have been supporting the ministry, in this case particularly in the area of TB. We have with us Dr. Rudy Eggers, who is the country representative for World Health Organization, and we also have Gerald Macharia, who is the country head of the Clinton Health Access Initiative. They have both been involved and have been supporting many of our programs, but today they're here because of their support that they lend to the TB program. Dr. Rudy, I will allow you to address the media for a minute or two, and then we will ask Macharia also to do that before we take questions.
Thank you, Dr. Aman. Good afternoon, ladies and gentlemen. Habari Amchana. WHO is delighted and honored to be part of this launch of the Kenyan Ministry of Health of the 2 new tuberculosis documents. One is the injection-free regimen for multi-drug resistance, and the other one is a treatment for latent tuberculosis infection for people at risk of developing the disease. As we all know, tuberculosis is a preventable and treatable lung disease that continues to ravage many vulnerable populations, households and communities in this country and across Africa. Nearly 2.5 million people contract tuberculosis in sub-Saharan Africa last year, and more than 660,000 died of this disease. In Kenya, the National Strategic Plan to Control Tuberculosis was launched 1 year ago with the aim of curing at least 597,000 cases of tuberculosis by 2023. Since then, Kenya has made progress in combating this disease and has adopted a robust, patient-centered strategy such as finding missing people with tuberculosis through active case finding initiatives, embracing new diagnostic tools, treatment regimens, and direct patient support. Now, with these new policies, by adopting a shorter, patient-friendly tuberculosis preventive treatment and prioritizing its scale-up across the country, Kenya has dramatically changed the TB prevention situation among people living with HIV, contacts of TB patients, and other high-risk populations. This new approach will ensure that latent tuberculosis infections are treated and protected from developing active disease. In addition, this adoption of an all-oral treatment for multi-drug resistance that replaces a painful and toxic injection that patients had to endure previously, it makes it easier for patients to tolerate and to adhere to this treatment. The adoption of both strategies follow the most recent recommendation of WHO, and through these strategies, the Ministry of Health expands its effective and essential patient-centered quality care of tuberculosis patients, particularly during this COVID-19 pandemic. Let me also say, as the COVID-19 outbreak escalates in Kenya, it is important that the essential health services, such as the treatment of tuberculosis, immunization, maternal and child health, and all those services are maintained. Even while we have to do everything we can to slow this racing epidemic of COVID, let us not leave behind the treatment of the diseases that cause long-standing and ongoing suffering. So Dr. Aman from WHO will remain committed to continue to provide support and guidance to Kenya to improve and overcome this fearsome disease. We congratulate the Ministry of Health in launching these two effective approaches. Ladies and gentlemen, thank you. Dr. Macharia.
Thank you, Dr. Aman, and Minister of Health officials who are here. Good afternoon, ladies and gentlemen. We, as the Clinton Health Access Initiative, popularly known as CHAI, have worked with the National Tuberculosis Program for the last 6 years or so on many areas. And today is just one of those special days that I would like to commend the program, led very ably by Dr. Elizabeth Odhiambo, that has worked very, very hard to bring us these two policy documents here to get us moving in a direction that TB very, very badly needed. There is nothing worse than getting TB and having to go through a very tough treatment regimen, and having policy documents that make that process much easier is a commendable effort and a commendable task. So I commend the Ministry of Health and the National TB Program for that. On my part, Dr. Aman, we as CHAI, in support of this effort, in support of these policy guidelines, have today donated 43,000 treatments for latent TB, and out of that 43,000 treatments donation, 4,000 of those are already in country and have been distributed to various health facilities. So it is not just the launch of the document, the documents or the policies. It's also the action that follows that also matters. So CHAI is glad to partner with you in making those policies a reality on the ground where the policies are much, much needed. And of course to the benefit of the patients who are waiting for these initiatives to be rolled out. In addition to that, Dr. Aman, we have also committed to working very hard to lower the cost of these treatments. Right now for the latent TB treatment, it's about 4,500 shillings per treatment. And I'm committing here to you that I'm working towards bringing that down to just about 1,500 shillings per treatment. And we'll be back again with you to apprise you of that development as it happens. We remain committed even on the drug resistant TB that we've seen cases come up. And again, there is work that is ongoing there to make the treatment even easier than it is today, even when we launch these documents. So thank you very much for this opportunity to work with you and your team, and we look forward to continuing to make these initiatives all come out for the benefit of Kenyans. Thank you very much.
Thank you very much. I want to take this opportunity to thank our partners, the World Health Organization, CHAI, and all those other partners and stakeholders who have supported us in our program, various programs, especially the program on TB. The documents that we shall be launching shortly are both aimed at making TB treatment accessible, easier, friendly to people, so that adherence is also easier for people to do that, and shortening the time that it takes. I think these are very important strides in the fight against TB, because we should now be able to reach more and more people with TB and move closer to our goal of eradicating TB by 2035. I want to say this piece now because I may not have an opportunity later, but I want to say that it is now my pleasure to officially launch the Kenya Injectable Free Regimens and Latent TB Infection Policy Guidelines treatment policies. We shall... Thank you. Makofi. Sikusikia makofi kali sana. Thank you. We will now take questions. After the questions, we shall proceed to that end of the podium here and launch those two documents. So as usual, we will now field a few questions, Colonel, from the media.
Hi, my name is Graham Kajilo from The Standard. My question is on, in April, the Cabinet Secretary for Health did mention that in 2 weeks' time from then, each county will have a testing center for COVID-19. As far as we know now, we have 28 testing centers across 12 counties. Why don't we have all the testing, 47 probably, testing centers across all counties, because we are almost here heading to the opening of the country. Also on the issue of isolation capacity of 300 beds per county, I would like to know, why don't we have ICUs, ventilators as part of the requirements for the counties? Because we understand once these numbers balloon up, even the numbers that we're talking about, that 20% people who are infected by the disease, they have severe conditions. This 20% will probably be a bigger number of patients. So why don't you have that as also the consideration?
My name is Anita Nkonge from NTV. My first question is, Uganda seems to be the only country in the region that has been allowed by the EU to be visiting countries in the EU, and Kenya seems to not have been included in the list. Is that an indictment to how Kenya is dealing with COVID in the country? Additionally, is the government facilitating a narrative of two Kenyas, the rich and the poor, when it comes to implementing COVID-19 rules? I ask this because yesterday there were reports of MPs who had allegedly gotten COVID-19 and they continue to be in large crowds.
I'm Haimba from Ebro TV. My question is maybe since the pandemic hit the country, how many how many people has the country lost through COVID, and maybe how many people have we lost as a country? They were suffering from COVID and they were at the same time suffering from TB. And maybe at the same time, so far, the patients that we have, how many are suffering from TB and they still have COVID?
My name is Brian Otieno from KTN News. A new swine flu has been discovered by Chinese researchers that has been described as being a pandemic potential. Is the ministry aware of this, and should Kenyans be worried?
Okay. Thank you, ladies and gentlemen. Kajilu, of the Standard, you stated that the CS had done, at one point said that every county will have 2 testing centers, 1 testing center. I don't seem to remember when this was and when he stated that. But if indeed he did, then I think he was just expressing the aspiration of our program, our COVID response, to be able to get testing to the points where it's going to be needed, especially now that we have community transmission that is well embedded within the country and within the counties, health being a devolved function and a responsibility of the counties. It therefore makes sense that the counties also be enabled to be able to provide the appropriate response. So that is an aspiration that of course we would want to have, if it is possible to get their facilities working, because they do have labs. Most of the counties have functional labs. It is a matter of putting in the right tests and equipment to be able to do that. I think we have done quite a bit of work with the counties to capacitate a number of their facilities to be able to do these tests. The 28 facilities that are currently doing tests, quite a number of them are actually placed in the counties and are facilitated by the national government. So we will continue to support decentralization of testing and bringing the testing closer to the people, because, as you know, this test also that we use, the RT-PCR, has a turnaround time of about 4 to 5 hours. It makes sense, therefore, to get it down there where it can be done immediately and the results obtained in good time. We have talked about truckers and the problem with trucks at the border points and all of that. This is all part of that effort to try to get the tests closer to the people. Your second question was about the 300-bed capacity. This is a target that was set for the counties, I think jointly set by the national and county governments, to be able to achieve this level of capacity and prepare ourselves for the surge that we may likely see as we approach our peak. I can tell you that these 300 beds are not just simple beds. There is a proportion of them that are going to be set up as ICU beds, together with all the other supporting equipment that is required, the ventilators and other equipment, the monitors that will be required for those who are critically ill. This has been well thought out, and there will be a portion of these 300 beds in every county. In addition to their existing ICUs, we'll build up additional capacity for ICU to be able to handle those that we estimate, given our figures, will move into that category of those that are requiring support for breathing. NTV, I didn't know that Uganda was one of the countries that has been provided the permission for their nationals to travel to the EU, and Kenya, you tell me, you're informing me, is not on that list. That's what you're saying, isn't it? I don't think I can comment on that. I think this is something we will have to perhaps liaise with our Ministry of Foreign Affairs to find out what is at play here, whether this is a final determination or whether it is a preliminary list. So I will not be able to respond to that at this point in time. Khayemba, yours was about COVID-19 and TB, and you want to know how many of those fatalities that we have seen so far in the country died because of a combination of COVID and an underlying TB. This data is available. I don't have it right on hand, but it is available, and we'll dig out through this data. We should be able to respond to you and tell you how many of those fatalities were a result of COVID, of course, with an underlying condition of TB. Equally, you wanted to know how many comorbidities have we noted now where TB cases are also COVID positive. Again, that is data that is available, and we can get that data for you. Finally, Otieno of NTV, I would like you to repeat your question because I didn't really get it, but I think the essence of what you were saying is that there seems to be a new strain of the virus. Is that what you said in China?
Yeah, there seems to be a strain of the swine flu that has been described.
Swine flu?
Yeah, swine flu.
Okay.
In China that has been described as being of a pandemic potential. So is the ministry aware of this, and should Kenyans be worried?
Well, anytime there is a pathogen that is deemed to be of pandemic level, of course it is a concern not only to Kenya but every other country on the globe. Here we are in the midst of COVID-19 pandemic. So any pathogen, and we know the swine flu, we know what the swine flu has done in the past. That information, of course, will need to be verified and backed up with evidence. But clearly, if it is a pointer to that, it is a matter of concern, and we should all be concerned. And the more the reason why it should be able to motivate us to strengthen our systems even further. Because we know that COVID-19 is not going to be the last pandemic that we shall face. We will see other pandemics in the future. We don't know of what nature. But we must build our health systems. Our health systems must be resilient to be able to cope with any disease or any pandemic that is likely to come up in the future. And I think this is what COVID is teaching the entire world right now. COVID-19 is teaching the world that it is really all about having robust health systems that can cope with any eventuality if a pandemic does break out. I think that's it. I believe I have responded to all the questions. So if you will agree now, we can move over to launch those two policy documents that we talked about earlier.
Congratulations to all government-sponsored students who have been selected to join Mount Kenya University. We welcome you to an institution that continues to impress stakeholders and whose alumni are rated highly by employers. September intake is in progress. Reporting date is 7th September 2020, and we accept inter-university transfers. Online registration is ongoing. Mount Kenya University, unlocking infinite possibilities.
Authentic, natural, planned,